Alright, welcome back to our ongoing video series on using Medusa's Siren ePCR software. In this video we're going to discuss how to provide ongoing assessment documentation using your ePCR. An example of ongoing assessment would be the further evaluation that you may perform on a patient who, for example, presents with an altered level of consciousness. You would want to document that you reevaluated that patient's level of consciousness during the course of your treatment and transport. Maybe when you got in the ambulance, maybe when you were en route to the hospital, maybe on arrival at the hospital, for example. Other examples of ongoing assessment that you may provide is pulse status. Perhaps you are dealing with a patient who has absent pulses, they're in some kind of circulatory compromise, you have CPR ongoing. This is where you can describe doing a pulse check or reevaluating their pulse status. Pupils, for example, would be another one. For example, a patient who presents with an opioid overdose and pinpoint pupils, or a patient who has a neurological injury and unequal pupils. There are a variety of different scenarios where you would want to be able to provide documentation that you have reevaluated the patient during the course of their time with you. We also utilize this section for documenting our initial exam for two specific situations. The first situation is breath sounds, and the second situation is heart sounds. So I'll talk about those first. Unfortunately, this can't really be documented well, breath sounds and heart sounds, in the primary assessment tab or in the baseline assessment tab. And so we are required to document it here in the assess/plan tab. It's a little bit out of order in relation to everything else that you're documenting in this tab, but it is the best that we can do with the code in the software as it's currently written. So if you are documenting the assessment of breath sounds on your patient, you'll want to click the breath sounds button. Now you'll see in the bottom part of the screen, in the lower window, you'll see an entry appears with today's date, it's time-stamped, and it lists the name of the person who is listed as the primary attendant on the call, states the item is breath sounds, and description is listed as incomplete. So if I double-click that, it opens up a window where I can edit the start time and date. I can include a stop time. So if this is not super relevant in this context, but in the context of other assessments or treatments, I can document the time that I started that assessment or treatment, and then I can document the time that I stopped that assessment or treatment, and I can edit who provided this assessment or treatment. In this case, it was myself, but perhaps I'm with a partner on a ground ambulance. I might want to document that my partner listened to breath sounds. Whoever performed the treatment or assessment should be listed as the provider that carried out the treatment or assessment. And then I can listen, or I can describe my findings based on the four primary lung fields: left upper, left lower, right upper, right lower. I have a total of 11 options to choose from, ranging from clear to pleural friction rubs, and I can choose multiples, and I can make each lung field different. So for example, a standard assessment, patient with no unusual findings, you might just note clear to all of the four primary lung fields. Very good. However, you may have a patient where you note decreased air entry to the bases, still no adventitious sounds, so still clear, but decreased. Whatever is relevant with regards to your assessment finding. Now let's say you had a patient where you wanted to reassess lung sounds later on during the course of your care with the patient. Maybe you did the initial assessment in the patient's house, and now you are just about to start driving to the hospital after giving them some Ventolin. You wanted to reevaluate their lung sounds. No problem. You can press the breath sounds button again, and what it will do is it will create a new incomplete entry that's time-stamped for the time that you press that button, and then you can enter into that, and then you can fill it in as you would. That's one option, perfectly, totally suitable, totally appropriate. Another option that you can do is you can utilize this copy button here that I'm highlighting with my stylus. You'll see the text pop up, copy. It's got two pieces of paper, it appears in the icon, one behind the other. If I press that, what that does is that creates a new identical entry with all of the same selections as the previous entry, but time-stamped for the moment that I press that button. So if there are no changes from my previous entry, that can save you a little bit of time. You just use the copy button, recreate that. If there are some changes, you can still open it and edit it so that it does sound, or so that there are changes in relation to the previous entry. And you can do that with any treatment. You can do that with any ongoing assessment. That's very helpful and can potentially be a big time saver for you if you are reevaluating or reevaluating something or readministering a treatment multiple times during the time with your patient. The other example of an ongoing assessment that we have to apply to our initial exam is heart sounds. Heart sounds, much like breath sounds, has a box where you have a bunch of different choices. This is the only real place in this ePCR to enter this information. So you would put the start time at the time of your initial assessment. You could describe the site that you listened to. You could describe the sounds that you heard. You could include any abnormal heart sounds or murmurs with this information. So we would expect to see, if you are assessing heart sounds initially, this is where you would document that. So breath sounds, heart sounds from your initial examination get documented in an ongoing assessment. All other ongoing assessments during the course of your care with the patient would get documented here. So for example, let's look at respiratory signs. Respiratory signs, this is the exact same number of selections that you had previously in the primary assessment box under breathing, except it was called breathing signs. Same. It's all the same stuff. Pupils. This is the same window as you would have had again from the primary assessment box under disability, under pupils. So you have likely entered many of these boxes already, so it should be fairly straightforward how to complete it. But this, again, as I have mentioned, and I'll mention it just one final time, allows you to document reevaluation of these components of your assessment for the duration of your call and as many times as you provide this reevaluation. So I would recommend that when you do have the opportunity to author an ePCR or practice with Siren, that you take a look at each of these boxes and you see what options are available to you. And remember, at all times, if you want to document an ongoing assessment and there are no ready-made boxes available for you that suit what you want to do, you can always use other. And this is a really good location just for one final example. Let's say I have, I'm transporting a patient by ground ambulance. So this is where I can say, for example, patient's lying on the stretcher, conscious and alert, in no obvious distress, no complaints. Great, so now I've done that, and then maybe 30 minutes later, for example, say I have a long drive, I'll highlight that, nothing's changed, patient's still hanging out, laying on the stretcher. I can copy that, and it will have the new time timestamp. So if it's 30 minutes in the future, instead of saying 14:02, that might say 14:31. Perfect. Save myself some time. And then I can also document that I am, in fact, reevaluating my patient just in a routine fashion. Okay, that concludes this video where we discuss the ongoing assessment section of the Assess Plan tab. In the next video, we will discuss the treatment section and protocol section of this Assess Plan tab. Thanks for watching and have a great day.